Let's talk about treatment of diabetes type 2, and today we are covering importance of vitamins and minerals. Here on the left, you can see how important vitamin D, it's actually not a vitamin anymore, it's a hormone. So take your time, explore. If on the laboratory work your vitamin D is low, please take a supplement. On the right, you can see when carbohydrates enter our mouth and then they go and the glucose converted inside the cell. It gets broken down and enters Krebs cycle. In Krebs cycle, glucose gets broken down totally and completely, and energy gets released. Okay, look how many different vitamins and minerals we need. B1, B2, B3, B5, magnesium, lipoic acid. We need manganese. We need vitamin C, coenzyme Q10, zinc, iron, and copper. That's why when I was in the practice, if I felt that patients for different reasons could be deficient in vitamins and minerals, I gave them supplement, liquid vitamins, and here is trace liquid minerals. Why liquid? I like liquid because they get absorbed really fast, much faster than taking a pill. I also put here magnesium for you. Why? Because many years ago, I read fascinating article in Journal of Endocrinology. Patients with diabetes type 2 entered hospital, and what they did, they gave them intravenous magnesium. Guess what? 2/3 of the patients get amazing improvement in controlling their sugar. So sugar went down and they just get rid of their diabetes type 2. Now, let's go to the blackboard and I will explain you how it works. By the way, I'm done. If you're watching my YouTube videos only for 2 minutes, that's it. So you don't need to go there. But for people who are curious, let's go for the explanation. I already pre-drew my favorite picture of the digestive tract. This is the mouse with the teeth, esophagus, stomach, lower esophageal sphincter. So when sugar in form of simple carbohydrate like that, or in form of complex carbohydrate, which looks like that when every sugar get connected to many sugars, enter our digestive tract. Remember, for our digestive tract, it does not matter. Is it simple, this sugar, or is it sugar from the complex carbohydrate? Sugar is the sugar. The difference only in the number of the connections and the time. But simple or complex does not matter. So sugar gets separated here, individual sugar floating in the digestive tract, and it's get absorbed through the digestive tract into the bloodstream. Let's draw the bloodstream as a red pipe. Okay, here is our bloodstream, and the sugar enter it here in the bloodstream. Here it is. As soon as sugar in the bloodstream, pancreas that located right here, P stays for pancreas, start to produce insulin. Insulin comes here with the sugar, and it looks like that. It's a complex. Insulin, sugar, floating in the blood. This complex get delivered into the cell. Let's draw a cell. This is the nucleus, and this is the cell. On the border of every single cell in our body, we have a receptor that will accept that sugar insulin. Let's say, well, not let's say, it is. It looks like that. Okay, this is the receptor. Because when this complex comes in, its sugar insulin get locked in, and there is a match between those. This is the insulin, and they click, and this receptor from the cell, because it's saying that, oh, perfect match, it's like a lock and the key. What happened? This sugar with cell receptor get incorporated, so sugar end up inside the cell, and insulin falls back. So insulin goes back, and it looks like that without sugar. This piece of sugar goes into the mitochondria, into Krebs cycle, where, as I said, energy get released. Okay. Now, what's interesting, in the places where the sugar insulin receptor located, that actually part has a that receptor has a two parts, external that looks like that, and internal part. So I will draw it like that. Or let me draw it a little bit differently. Okay, let's say the receptor is here, sugar insulin receptor. So this is external part. There is also internal part here. And this internal part surrounded by magnesium. And magnesium is responsible to hold this receptor steady. So the sugar can sit here with the insulin, and that's the match. And then magnesium brings the sugar inside the cell. What happened? When the person becomes deficient in magnesium, this receptor external part does not look that healthy. It looks like kind of like that. As a result, crooked. When sugar insulin comes in, it comes in and it tries to sit right here, and there is no match. As a result, this sugar insulin complex, the sugar does not get internalized inside the cell. As a result, the sugar is floating here. And the more such damaged receptors or unhealthy receptors without magnesium receptors are in our body, the more sugar floating in the blood, not internalized, not used by the tissues. As a result, next time you put something that has a sugar, so that sugar get brought into the bloodstream. In addition to this sugar, you have more sugar, more. So as a result, the concentration of the sugar in the bloodstream, concentration of sugar is going higher. As a result, diabetes type 2. Now, I want to bring your attention to this important point. This magnesium that is holds this receptor, it's internal magnesium inside the cell. That's why it's important to remember. Often, the physicians measure magnesium in plasma. The deficiency of the plasma may be there or maybe not, but we do not measure inside the cell the magnesium, okay? And it's called intracellular magnesium. And if it's deficient, although plasma magnesium is normal, patients will have diabetes type 2, okay? So my suggestion, and let's go back to PowerPoint for a second. It's important to take magnesium. There are other minerals you saw on the picture. So could be zinc, could be chromium, could be magnesium. So take trace minerals and take a little bit more magnesium. Now, how much magnesium to take? In general, I recommend to take 500 milligrams. This is the standard dose. But if you take a liquid magnesium, you may need low. The side effect of magnesium could be loose stool, because magnesium is a muscle relaxant. So if you take a 500 milligrams and you have a loose stool, then you assume that it's too much for you. Go to 400. If you have problems with the 400 milligrams loose stool, then go to 300. Nobody can tell you how long it will take for you to fill up that magnesium. Some patients need several days, some weeks, and I had a patient who took 2 or 3 months. Okay, so guys, good luck. Experiment with liquid vitamins and minerals. Bye-bye for now.